Well, and I think that's where we have to take a little bit of a step back and remember how the conventional medical system was developed. It was developed to be a kind of power differential, a patriarchal model where the person with the degree, the license, the information kind of benevolently gives it to, and has all this like knowledge, gives it to the patient. And that is actually not modern evidence-based medicine, where we take into account the patient or client's own experience, their response to treatments, their internal wisdom, their knowledge. Look, we now have extensive access to knowledge simply as individuals to learn about our own conditions that our clinicians don't have as much time to read about because they're responsible for lots of different conditions. So I think that while the model was developed in one way, times have changed dramatically, but the model has not adjusted. And so, of course, our clinicians aren't really learning this in their training programs. And so they're trying to fit a round peg in a square hole and are really exhausted because the model doesn't align with what's really needed and what's really happening. And so both clinicians and patients are getting frustrated. And this happens across the board. And this is why the vast majority of our health professional, wellness professional students actually come initially, many seeking their own healing, because working in a healthcare career can be damaging to your health. It just can. And hospitals know this, right? Because there's all these like wellness programs and mindfulness lunches and stuff like that. But that doesn't really get to the root problem. It's like a little tiny bit of like lipstick on a pig, if you will. And so when students come to us as health professionals themselves, we also see them as humans who are often undergoing their own healing journeys. And what I feel like would be amazing in the transformation of healthcare, and what I think this company is truly about, is leading, innovating transitions and healing of the healthcare system and environment. So when people join our community and enroll in our school, our support for them initially is, let's help you learn how to optimize your own health. And as you were saying, create your own vision, create your own boundaries, create your own kind of wellness, self-care strategies. So people come to us with their own health issues, but they also sometimes come just needing to know that they're allowed to advocate for their own health. And I've been in graduate school for healthcare for a total of 7 years plus undergrad. Not one person ever said to me, like, the most important thing for you to be a great healer is that you have boundaried sense of your own need for your own health, so that you have the capacity to safely hold space for other people to heal. Never heard that once.
No, never. In any of the years of education.